This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Okay, so you go to the doctor's office. Doctor comes in to examine you in the white lab coat, maybe a necktie, maybe you notice a name tag. Here's a question for you. Could the way your doctors dress actually be to blame for spreading germs? Some studies suggest they might, which may pave the way for doctors to change their dress codes. Joining us today to tell us more about that is Dr. Chris Snyder, who's the Chief Medical Informatic Officer and Hospitalist at Peninsula Regional Medical Center. Thank you so much for coming in this afternoon. Appreciate it. So, I never thought of this before. How a doctor dresses could affect whether or not they're transferring germs?
Yeah, there's fairly good amount of evidence out there that, again, we've talked about hand hygiene and the importance of hands and washing your hands, but the transmission of infection can occur from any contact. So you always got to be worried when you have contact and you carry it from room to room with patients, how you could potentially transfer that. So anything dangling, anything clean, instrument cleaning, those things are all imperative to make sure that we're not transmitting, especially the superbugs and the folks, the Clostridium difficile and a number of other pathogens that we deal with on a day-to-day basis that are resistant.
Right. Okay, so the Society for Healthcare Epidemiology of America, or SHEA, took a look at these risks, and they're seeing problems with lab coats, name tag, even ties. Really?
Yeah, so lanyards, ties, badges, again, if it makes contact with the patient's environment, so patients are themselves carrying bacteria. Transferring that bacteria from one room to the next is typically done by providers. Some of it's passive, some of it's active. Hand hygiene is probably the main component because that's obviously how we shake hands and exchange with each other information. So, but the challenges are when you have a tie or a lanyard on, if you lean over, or a stethoscope, those things need to be cleaned between patients. So we actually emphasize that in a hospital, and eliminating the tie and the badge and even the white coat, which goes from room to room, could very well prevent infection. So, and the studies are showing there is a potential to transfer infection.
So do you think this is going to mean some dress code changes for PRMC?
We've had some actually. So, and I don't know if there's a number of reasons why we have dress code. Number one, we dress our nurses all in blue, so they're identified as an RN. Right. We dress our medical assistants in maroon so that we know they're all medical assistants. So, color's one thing, but infection control, absolutely. Doctors, we're trained to dress up. There's a certain impression that patients have of their physician from a professional standpoint, but I think the times are changing because of the infection. A lot of us wear scrubs in the hospital. I personally do, and I don't take them out of the hospital. We also have unified shoes that we keep in the hospital or in the operating room that are specific to that, so we're not bringing external dirt into the operating rooms, into the emergency rooms, everywhere else in the hospital.
Okay, so we've talked about dress code, ties, things like, we talked about scrubs, we've talked about your shoes. Is there anything else that we can pay attention to that might help cut down this?
Absolutely, yeah. So if patients are at risk for infection, obviously you want to prevent that. So one of the dress things that we need from families and patients, specifically families, because families come out from the environment, they need to be held to the same accountability for hand hygiene. And then we have isolation rooms for people who have like methicillin-resistant Staph aureus, the MRSA, and Clostridium difficile, which is the bacteria that causes your colon to be ill and have diarrhea when you have antibiotics. So those areas, we ask folks to wear gowns, specific gowns or shields while they're in the room. Okay. A lot of families don't understand it's not to protect them, it's to protect the patients outside of the room. So again, leaving those gowns when you're going into a room, wearing them, and when you're coming out, taking them off, and then performing good hand hygiene when you come in and out of the room are probably the most important elements in the hospital. And I think the community needs to understand we're doing it to protect the community, not necessarily just them.
Right. Okay. So let's say I'm going to my doctor's office. Is there anything I need to look for in particular as far as my doctor's dress or presentation or anything like that when it comes to infection?
Again, hand hygiene. Number one, make sure they wash their hands. Remind us to wash our hands, please. We ask you to. Empower the patient to make the decision. So the community needs to remind the healthcare provider, please wash your hands before you touch me. And I think that's the major element. As far as dress goes, a lot of physicians have dropped the tie, a lot of physicians have dropped the badges. The hospital has a much higher prevalence with this just because how sick people are.
Right.
In the community, you have much less of an issue other than flu season, where we obviously need to really be practicing what we preach for hygiene.
Alrighty. Well, Dr. Snyder, thank you very much. I appreciate it. And yes, I want to make sure that I clean my hands after having shaken yours, so I apologize for that. But thank you so much for some very important information this afternoon. Now, if you'd like to read more about PRMC, all you have to do is go to DelmarvaLife.com and click on the show tab. Up next on Delmarva Life, we speak with former professional football player Hines Ward. Find out how he's staying in shape now that he's retired, and how you can get over your hurdles if you're trying to get fit. Plus, ever find yourself in a bind after you hired a home contractor? Maybe he took your money and ran. Angie Hicks from Angie's List has some advice on how to recover your losses. But first, we learned about staying healthy so we don't feel yucky. For many pregnant women, they often feel sick when they wake up. Dr. Oz has more on how to deal with morning sickness.
Hi, I'm Dr. Oz. For 80% of pregnant women, morning sickness is a frustrating and debilitating part of the package. Ginger reduces nausea in pregnant women. Eating bland foods throughout the day helps as well. Vitamin B6 can also be effective. If nothing else works, talk to your doctor about prescription medications.